Assalamualaikum and hello everyone. Welcome to our presentation for the course Patient Care 1. I'm Najwa Farhana BINTI RAHMAN, matrix number 059669 as the host, and we have two panels for the presentation. The title given for the presentation is Drug for Miscellaneous Emergency. The first panel is ALIA MURSYIDAH binti SHUKRI, matrix number 059607. Alia, how are you today?
I am fine, thank you.
The second panel is NURUL HUSNA binti OTHMAN, matrix number 050941. Husna, how are you today?
Okay, I'm fine, thank you.
From the title of the presentation, miscellaneous emergency is a condition where patient experiencing non-severe disease. This emergency has wide therapeutic application. Next, Alia will show us the types and nomenclature of the drug related to this topic.
There are many drug types and its nomenclature for these miscellaneous emergencies, such as paracetamol, or we call it as acetaminophen, ibuprofen, aspirin, naproxen, morphine, oxycodone, and COX-2 inhibitors.
Husna, what's the classification and description of drug of miscellaneous emergency?
Hi, I'm NURUL, and next is the classification and the description of drugs. There are 5 types of class of drugs, which is analgesic, antibiotics, antidote, prostaglandin, and also the last is corticosteroid. For the analgesic, which is first is the paracetamol, used to be a pain reliever and also a fever reducer. Next, typically used for mild to moderate pain based on the scale. Next is the non-steroidal anti-inflammatory drugs called NSAID, which is used to reduce inflammation and for better pain reducer. It is usually used for treating the arthritis. And there is COX-2 inhibitors for special category under NSAID. Next is opioid. So opioid is used to relieve very severe pain such as cancer pain, and it also referred as the narcotic analgesic. Next class is the antibiotics, where the first is the penicillins. Penicillins can treat infections by killing the bacteria or other susceptible organisms or inhibiting their growth in our body. They block cross-linking via competitive inhibition of the transpeptidase enzyme, and also inhibit cell wall synthesis. Next is cephalosporin, a class of beta-lactam antibiotics, originally derived from the fungus Acremonium. The cephalosporin inhibits the bacterial cell wall synthesis via competitive inhibition of the transpeptidase enzyme, also similar to the penicillin. For the class antidotes, which is the first is physical antidotes, is by interfering the poison with physical properties such as absorbing, coating, and dissolving. So the charcoal is classified as the universal antidotes. Next is chemical antidotes, which neutralize the toxicant by interacting with it specifically. Next is the physiological antidotes, which is produce the opposite effect of the poison in our body. It is a used substance such as sodium nitrate. Next class is the prostaglandin, which is a group of lipids made at site of the tissue damage or infection, which serve as hormone-like effects. They control the process such as inflammation, blood flow, the formation of blood clots, and also the induction of the labor. For the non, they have also the same function of the NSAID. For the last class, called corticosteroid, this drug with beneficial effects that delay for several hours at least. So they lessen the swelling, redness, itching, and allergic reaction in a few hours, and all of the agents have similar anti-inflammatory effects but differ in their mineralocorticoid potency.
I would like to share routes of drug administration and dosage related to miscellaneous emergency. For paracetamol, you can choose either to take 325 to 500 mg of paracetamol orally every 4 hours, or you can take 500 mg to 1000 mg every 6 to 8 hours. For dicobalt-etidate, this indication for cyanide. So first, we need to inject 300 mg of dicobalt-etidate intravenously about 1 minute, and further dose of same amount of dose will be given if required. For inflammatory bowel disease, for IV injection, either 20 mg of methylprednisolone or 100 mg of hydrocortisone every 8 hours. For oral medicine, you can take 10 to 40 mg of prednisone per day. If adult has fever, you need to take 200 until 400 milligram orally every 4 to 6 hours. But for children from 1 year old until less than 12 years old, you need to take about 5 to 10 milligram per kg every 6 to 8 hours. For cephalosporin, adult dosage is about 1 to 2 grams of cephalosporin to IV every 8 hours. And for children, dosage is about 100 to 200 milligrams per kg every 8 hours. I will pass the presentation to Husna that will explain to us about clinical indication and contraindication of drug of miscellaneous emergency.
Next is the clinical indication and contraindication, where the indication is when to use the drug and the contraindication is where the drug is harm to the patient. The clinical indication of analgesic, first we have the paracetamol, where we use it for fever, mild to moderate pain. For the NSAID, used for the arthritis, dysmenorrhea, which is for the period pain. For the opiates, we use for post-surgery pain and also the cancer pain reliever mostly. For the contraindication of analgesic, for the paracetamol, it is inhibited for the person who have chronic liver damage, asthma and allergy. For the NSAID, it is prohibited for the person with hepatic ulcer or stomach bleeding and people allergic to sulfonamides. For opiates, it is inhibited for the primarily respiratory depression. For clinical indication of the antidote, it is based upon risk-benefit analysis. The antidote is used which means given for emergency, and if severe, will bring them to the nearby hospital. It is used for food poisoning, snake venom, antihistaminic. While for the contraindication of antidote is used when the patient is uncooperative and uncontrolled vomiting. Next is the clinical indication of the antibiotic. For penicillin, used for pneumonia and also the Vincent infection, usually seen in the gum. For cephalosporin, we use for skin or soft tissue infection, urinary tract infection. While the contraindication of antibiotics for penicillin with patients with previous history of severe allergy reaction and patients who have Stevens-Johnson syndrome, which is the redness on their skin. For the cephalosporin, for patients with allergic or previous anaphylactic reaction to penicillin or other beta-lactams antimicrobials. Next is the clinical indication of the prostaglandin, which is used for rheumatoid arthritis, osteoarthritis, inflammation pain, and also for the glaucoma that is seen in the eyes. While the contraindication of prostaglandin is for people with uterine scar, anemia. This is the clinical indication of corticosteroid used for Crohn's disease, asthma, ulcerative colitis. As we know, Crohn's disease and ulcerative colitis is the inflammation that occur in the large intestine. The contraindication of corticosteroid is for chronic diabetes, peptic ulcer, cataracts, osteoporosis.
ALIA, can you tell us about clinical application effects of drug and also pros and cons of the drugs related to this topic?
Next is the clinical application effect. So for the paracetamol, it can relieve a mild or moderate pain such as headache, toothache or sprains. It also can reduce fevers that caused by illnesses such as colds or flu. Paracetamol also doesn't really have a serious side effects. Next is the NSAIDs is good at treating the pain that caused by slow tissue damage such as arthritis pain and also work well in fighting back pain, menstrual cramps and also headaches. Next also is the prostaglandin that can be a healing effect, especially in the stomach. They can decrease the stomach acid production while stimulating the release of protective mucus in the GI tract. Next is corticosteroid. They can suppress any inflammation or severe allergies. The pros and the cons for the drug of miscellaneous emergency. First, for the pros, the drug is checked and examined. Next is wide therapeutic application, good bioavailability after oral admissions, low toxicity in children, well tolerated, cheap, fast eliminations, and it has a rare side effect. While it has the pros, it also has the cons. So the cons are it can metabolize to a toxic metabolite. Sometimes the drugs also not efficient at the low dose. In long-term applications, it also can cause higher blood pressure. And last, it has a low therapeutic efficiency.
So we are in Q&A session. I asked to HUSNA. Most children and some adults have trouble to swallow the pills or capsule prescribed by doctors. How the healthcare profession could fix this problem?
To answer this question, the person that have difficulty to swallow pills, food or liquid may suffer from dysphagia. But first, we will precise about the general condition of swallowing difficulty of pills among the patient. Some patients can be helped with simple swallowing techniques, but for other patients who have mild or severe swallowing difficulties, they need to seek the doctor to discuss the solution related to their problems. The most important to the patient is never chew, break or crush the pills without consulting healthcare professional. The chewing, breaking or crushing the pills will change the mechanism of medicine absorption into the body, and this will affect the medicine effectiveness.
Question number 2 for ALIA. Can the patient take both paracetamol and antibiotics simultaneously?
Thank you for the questions. There are literally hundreds of antibiotics used to treat infections. So once you receive your prescriptions, ask your doctor or pharmacist if you can also take the paracetamol at the same time that you take the antibiotic. The best way to determine if you can take any two medications together is to have a drug interactions screen performed by the healthcare provider.
Presentation is over now. Thank you for watching our presentation. Stay safe and stay healthy. Assalamualaikum.